This is EDM. I'm going to give you a brief overview of EDM, PDOC documentation, and CPOE order entry. We're going to start by doing an overview of your tracker here. When you hear the audio end, you'll need to click to go to the next page. Now look to the left, see the columns with the room numbers. You'll notice they're highlighted in blue. This simply means that registration has not finished registering the patient. The room number will turn backlit white once registration has finished. This is an indicator for the nurse to know not to discharge a patient prior to full information being gotten by registration. Now we're going to take a look at patient name display. As you can see here on your tracker, the first three of the last name is followed by the first two of the first name. If this patient's name is highlighted, you will see the full name display up top. In this example, you will note that patients' last names are highlighted in maroon. This simply means another patient has a similar or the same last name. Here you can see the patient's age. You'll also know that age is colored based off of that patient's gender. Pink is for female, blue is for male. This next field is a priority indicator, so you'll notice there are different colors for different priorities. Priority 1 is going to be red. Priority level 2 is pink. Priority level 3 is gray. Priority level 4 is green. And priority level 5 is blue. Here you will see the chief complaint. This chief complaint is a patient's stated reason for visiting to the ER. This gets input during reception. Here you'll notice you only get to see a brief amount of the chief complaint. I'm going to show you another way later to look at the full chief complaint statement. This next section is a name assignment holder. As you can see, members of the healthcare team will apply here. You can see the physician under doctor, you can see mid-level in the middle section, and you will see the nurse who signs up for the patient in the last column on the right. This is the order indicator section. Starting from the left, you'll note R is for radiology, L is for lab, B is for blood bank, E is for EKG, and the last R there is for respiratory. A/T is assessments and treatments for nursing documentation, and MED stands for medications. Now you notice something is in red, it means it is a new or undocumented order. If something is in green, it is completed or it is documented. If it's green, you can click on it and see the results under review. If you see colors in between like blue, blue is in progress, and purple would mean that something in that order set was canceled. Next, we're going to look at the TES indicators. T stands for travel, E stands for Ebola, and S stands for sepsis. The travel indicator will be green if the patient has not traveled outside the U.S. in the last 3 weeks. Now that T will highlight red if they have traveled outside the U.S. in the last 3 weeks. E is Ebola questionnaires. If they answer positive to either being in a region or near an animal or a person of suspected Ebola, that will turn E. That will be red. You can click on it and see what answers they had to those questions. Now the S for sepsis. A black S means that they were positive on a first-tier sepsis screening. This happens in nursing documentation every time they do a vital sign recheck. It also pulls in from lab results. Now if you see a red S, this means this patient was positive in a third-tier sepsis screening, so that would be severe sepsis. This is a comment indicator on the tracker. This is not a part of that patient's record. It does not go anywhere or stay with the record. This can be used by nursing, for example, as a way to remind themselves that I have a second troponin due at 1400. Or you as the physician can use this as a communicator to your nursing staff to say UA ? If you are missing a UA and that's the only result that you need. So this will depend on your department's use of this section, but you can click into it, see full comments, and add comments. DISP stands for disposition. So this is the disposition section on the template. You'll notice that after you have charted a disposition, whether that be discharged home or for an admit, this is where it's going to display on the tracker for nursing staff to see and to get that patient ready to go. A green D is discharge home. A red A means the patient was flagged for admit, and occasionally you will see a blue T for transfer. TID stands for time in department. This section just allows you to see how long a patient has been in the emergency department. Patients with a color green time in department means they've been there under an hour. Patients who have been in the department between 2 and 3 hours will display gray. Once a patient has been there longer than 3 hours, it will display red. It is hard to see, but that is a yellow pound sign. This is a view-only indicator. If you click on it, it will allow you to see information about the patient, such as triage information, last set of vital signs, allergies. This is something that nursing staff might use for report to and from other providers. Here's the review screen that will appear after you've clicked on the yellow pound sign. As you can see, it's the last filed responses. So that would be vital signs, part of their triage for subjective and objective assessment. It'll give you arrival dates, triage times, placed in bed. Just a quick look up. Now we will cover the buttons on the right-hand side. We're going to start with sign up. The sign up button is how you apply your name to a patient. As you can see, you've got a patient who had a purple box previously where no one had signed up, and after the physician or provider signed up, it then populated a name. PCI will take you in to see some of the patient's past clinical information, so if the patient has been with any of our facilities before, we will have some type of information on previous ER visits and or admission stays. This is an example of what you would see if you were to click on PCI. Use the arrows on your keyboard to navigate into and out of each of these sections. Snapshot is a place where you can see the patient's complete chief complaint from their time of reception. This button can be used, for example, if you know you met an EMS patient as they rolled through the door and started your workup then at the bedside. The nurse would then put the patient in and have to back time to the correct time that the patient walked through. If you were to click on Snapshot, it would show you their arrival date and time as put in by the nurse at the bedside. Again, this is what Snapshot would look like if you were to click on it. You'll see arrival date and time are highlighted, as is the stated complaint. By clicking on Orders, this will take you into CPOE, Computerized Order Entry. This is where you place orders on your patient. When you click on Orders, this is the screen you will see. As you'll note on the right-hand side, you have Order Sets, Orders, and Meds and Fluids in separate tabs. We will cover more on this later. The Order Summary button is usually used by nursing to view orders in a summarized version. This just puts the date and the time the order was started. The Comment button takes you to the comment indicator that we viewed earlier. You can either click on the comment indicator or you can click on the comment button. They both take you to the same place. Go to is a patient search function. Simply type in the patient's last name, comma, first initial, and click F9 to see your options. The Summary button leads you to a place where you can find reports in a printout version or a view version. This would be the emergency patient record, which is the patient's entire stay in the ER, the triage report by nursing, lab and radiology results, first point of contact screening. Most of these are reports that will be printed out if the patient is being transferred. Document will take you into the patient's PDOC note. We will review this at a later time. The Sign button is one of two ways to sign off on your charts at the end of the day. This will take you to a Sign Queue bulk to sign all orders, verbal orders, etc. And there is another way that I'm going to show you to sign your charts as well from the tracker. This is an example of the sign queue if you were to click on the sign button and what it would look like when it takes you to sign charts multiple at a time. If you have your desired patient highlighted and then you click review, this button will take you to review information about this patient. That could be vital signs, lab results, radiology results, CT results, any documentation done by the nursing, etc. Everything will be in review. This is an example if you were to click into review. As you can see here, there's a pair of vital signs. You can see on the right-hand side those columns. Anything in blue means something new has been documented there since you've last been in there. On My List is another way to add patients to your personal tracker. However, if you clicked sign up for the patient and put your name on the chart, that will do the same feature. So you won't use this often. Mostly scribes will use this to pick up patients and follow them on their private tracker. The Edit List button is a way to edit patients that are on your personal tracker that you've picked up once you're finished with their charts. We'll cover that in more detail later in class. Clicking on the tracker button will take you to multiple tracker options. You can use whichever you would feel like. There's no right or wrong tracker to use. As you can see here, you also have access to a main My Patient one-line tracker. This is a way to see patients that only you have signed up for, something maybe you'll use ideally at the end of a shift when you're wrapping up and no longer picking up new patients. We are now going to do a brief demonstration about charting on a patient in EDM. We will begin by choosing our patient and clicking the Sign Up button. You will note the test physician name has now populated into that space, and we will click Document to enter a template. Once you've been using PDOC for a while, you will build a favorites list. Every time that you click Open to document on a patient, it will automatically default to your favorites list unless you click All. For this demonstration, we are going to click Abdominal Pain under 40 template. You will note a few things here on the template. At the top, service date and time. This is simply the time that you open the template to document, nothing else. Below that, you see the date/time seen by provider. It's also populating with the date and a time. This is the time that you signed up for a patient. It will capture the time that you see the patient by sign up. Now, you can also choose to edit this if you signed up for the patient later. You will notice there are asterisks besides certain pieces of this template. Anything that is asterisk means it is required in order to sign the template at the very end. You could consider this the bare minimum or the bones of the chart. In the next couple of slides, you're going to notice I'm going to click through some of the template, documenting on some of the required fields so that you can see what the look and feel of this looks like. To get to the next section of the template, you'll simply click on one of the tabs at the top. You will also note, depending on the patient's gender and which template that you choose, the asterisks for the required pieces of the template will change. This is the Review of Systems tab. You will be able to review pieces of the patient's system in here. You'll notice there are no asterisks. This is going to be up to you as to how many you do, although there are certain amounts required by billing. You will notice in some of your options there is a symbol of what we call a caret, which is a downward facing arrow. You can click this and choose to add more information that is already pre-populated. This section of the template is a basic physical exam. These would be for normals, so if you click on this, these are going to be for normal physical exam features. If you want to check everything on a certain location, you can simply use the check mark at the top, and this will select all boxes. You will notice here we have come across a free text or data format section. There are a few of these throughout your charting within the templates. So here we're going to click on the Data Formats button on the right-hand side column. You'll notice there are several options of things that you can select and pull into your documentation. Here we're going to choose to pull in vital signs as documented by the nurse. If vital signs have been documented on this patient, you would have seen those vital signs import into the template. You can also free text in this area as needed. Now we're going to click on Text. By clicking on Text, you can pull in canned text or pre-populated information. You can choose to scroll through these to see what options that you have. For now, we're just going to look through them, and then we're going to cancel without choosing anything. This is the procedures section. You can choose to add any procedures you perform while in the ER. This section of the chart is for interpretations and discussions regarding the patient's visit. This is the reevaluation section. You can choose to put patient reevaluations and consultations. You'll find different things throughout here. We will click in the clinical impression tab so that you can briefly see how to add, rule in, and rule out clinical impressions. This is a filter through, so just type as much as you can and then it will begin to filter options. This is the disposition section. This is where you will choose whether the patient is being admitted or if they're being discharged home or being marked as a transfer. You also have to add in a disposition date and time for this information to flow over for nurses to see on the actual tracker. Now, you shouldn't put in this information until you are ready to make that decision. After that, there is a timer that starts for nursing to get patient out within 25 minutes if they're going home. Now, you may not document all of this information at once when documenting on a patient. You have two options. You can either quick save, which will close and exit out of the template right away if you need to get up and walk, or if you would like to review your information before saving it to draft or before signing, you would click the Submit button. Here you can see a pretty view of the chart and everything that's been documented thus far. You'll notice at the bottom that draft is highlighted in black. This means that you can save this into draft. It's not complete yet. You'll notice the signed button is grayed out. That's because we have not documented all of the required information yet, all of those asterisks that you saw. You can see that required data button on the right hand side is highlighted, so that means you have required data that need documented. You could choose to click that button, document the required data, or you can choose to go ahead and submit into a draft right now. We will now do a demonstration for orders. We're going to start by doing an order set example. After working with orders for a while, you might develop some order favorites. After you've developed order favorites, you'll notice it will always default to favorites first, but you can choose to go to all sets. Each order set is broken down into tabs. You'll notice here that we've got laboratory orders at the top, and it shows you that 7 out of 20 are pre-selected. Each order set will have different pre-selected labs and orders. You can review them, remove those you don't want, and add those that you would like to see. I'm going to select a radiology order so that you can see one of these blue pencils turn red. If a pencil is blue, there's no extra information needed. If you see a red pencil on the side, that means there is additional information that you must input. For the first question, we are going to free text a response. If it is not a free text response and you do not see any answers up top that it's prompting you to give, always push F9 for more options. I'm going to unclick an order here, for example. There were meds and fluids included on your order set. However, I'm going to show you how to put them in from the Meds and Fluids tab here on the side. It is important to note that the medications and the fluids are in different tabs up top. You must be clicked into the correct one to get the correct formulary. For example, if you're clicked into medications and you try to order a bolus of normal saline, it might tell the nurse to pull out multiple 10 milliliter saline pushes and to push all of those. They're not going to want to do that. So just make sure that you're correctly into the right tab for whichever medication or fluid you're going to order. To find a medication or fluid, it is a type ahead function. It will begin to narrow down until you find the one you are looking for. We are going to choose a pre-built string to fill in the information needed up top to order this medication. Something you should note. Every pharmacy has pre-built these strings to match medications that your facility will carry. So it's easier to choose one of these pre-selected strings, although it is possible to edit them if you wish to have a different dose. It is now time to submit the orders. You'll notice that the order status is green and it says new. That means we are not finished yet. You have to finish submitting these orders and typing in your personal signature password. I want to point out something on the medications here. You'll notice there is a start and a stop time under medications. So medications have an automatic timeout capability that is set up through the Pyxis. For the most part, it's set at 4 hours at each facility. This is to prevent patients who get admitted from having orders that can be pulled by nurses upstairs that were meant for the ER. Now, the only time this is ever really a problem, for example, would be when you have a septic patient who's a very hard stick. Maybe you only have one line and there are 3 antibiotics ordered for this patient. That last antibiotic might time out before the nurse is able to pull it. So the nurse will just come back to you and ask for you to reorder that medication because it has timed out. And when it times out, it auto-cancels. Other than that, it should be good. This is a safety feature. I'm going to show you how to DC an order. We're going to select an order and we're going to click DC and put in a reason. I'm now going to show you your My Tracker that was mentioned earlier in the video. This tracker is going to be a list of only the patients that you have personally signed up for. This is something you might use at the end of your shift to keep track of your charts and which ones you need to finish. The My Patient 1 line is the most commonly used. You will notice there are 3 charts in 3 different statuses. The first one is in a canceled status, so this just means the template was canceled. The second one is in a draft status, that means it's unsigned. This is showing you a chart that is still open. And the last one you can see, it is in a signed status, and it is also in an e-signed status. This shows you that a mid-level signed off on that chart, and then you as the physician have gone in and signed off your piece of the chart as well. E-signed is the final status for a chart. We're going to click on the draft status and take a look at that chart. Now let's say you're not finished charting. You can put this back into a quick save status if you need to get up. Again, this only places it in draft. We're now going to return to the main tracker. We're going to click on trackers and click at the tracker on the very top. That will always be the main tracker. This is the end of our overview. Hopefully this gives you enough insight for you to be able to recognize things when we start class for hands-on training. Thank you.